All right, we're back with Coffee Talk. It's 8:41. We have got Dr. Luna in with us this morning. We're going to talk about, we're going to talk about a couple of things, but we want to talk about vaccinating your pets. Good morning, Dr. Luna.
Good morning. How are you today?
I'm doing well for a Monday.
Yeah, exactly. Thanks for having me, though.
Well, thank you so much for joining us. So, pet vaccines, that's one of those things. I don't know. Some of us aren't as good about keeping up with that as probably we should be. So talk to me about vaccinating pets. Where does it start? What do we need to be on top of?
Well, in general, puppies and kittens, you want to start about 6 weeks of age. They usually get a series of 3 to 4 what we call primary boosters. So they're coming in starting at 6 weeks. Every 2 or 3 weeks after that, they're getting boosters of distemper parvovirus. Your cats are getting feline distemper vaccines as well. It's really important that they get that one vaccine between 14 and 18 weeks of age. That's probably the time when the body is most primed to receive that vaccine and respond to it the best as far as the primary vaccines go. And then that's also the time we usually give them rabies vaccine. After that initial primary series, then these guys are coming back every 6 months depending on the vaccine that we're giving, and then every year for rabies, boosters, deworming, all that good stuff. So I guess the takeaway from the story is you want to be sure you do your puppy vaccines starting at 6 weeks, and then your veterinarian's going to tell you where to go from there. And then once you get those primary boosters in, then it's basically on a yearly basis, and then depending on the vaccine, sometimes it's every 6 months.
All right, and basically on a yearly basis, so we're looking at...
So on a yearly basis, you're looking at vaccine for rabies, which that's pretty common, dogs, cats, horses, things like that. Distemper parvo vaccine, which includes more than just distemper parvo, but also includes vaccine for a couple of respiratory viruses that they get as well. So even though people come in and say, yeah, we want that parvo booster, it's actually including a lot more than just that as well. And then if you're getting a kennel cough vaccine, which is also known as Bordetella, usually that vaccine, your breeders, your groomers, anything that's traveling, going to shows, just going to have a lot of exposure to other animals. That's one you probably want to get every 6 months. But that's kind of it as far as kind of the core, we call core vaccines. Now, if you have animals that are, farm dogs, like your Great Pyrenees, they're herding, things like that, then you got to give some consideration to what we call non-core vaccines, such as lepto, which they're going to be exposed to, Lyme disease, things like that.
For just the core vaccines, for just, our normal little house dogs, what sort of price range are we looking at on a yearly basis?
So at our clinic, over at Rogers Veterinary, rabies vaccine is about $9. The distemper parvo and feline distemper vaccines are about $23. In with that, though, we also recommend that they get a yearly fecal screening as well. So we're taking stool samples, looking for parasites that they're going to be exposed to while they're outside, such as roundworms, hookworms. Those are kind of the big ones, which is usually about $10, $11 for that test. And then probably the other big thing that we do, along with the vaccines, the fecal testing, is a heartworm test. And heartworm disease, though there's no vaccine for it, it's a very, very prominent disease. We probably see hundreds of cases at our clinic a year that get, basically dogs and cats can both get the disease, but they get it by being bitten by infected mosquitoes. We do a little in-house blood test at the clinic, have results in about 5 to 10 minutes, and that tells us if they're positive or negative, and then we kind of go from there. But it's very important, not just from a vaccine perspective, but from a parasite perspective as well, that these dogs are coming in every year. Not to mention roundworms, hookworms, those are things humans can get, especially young children, elderly people that are immunocompromised. So it's not just good for the animals, it's also good from a public health perspective.
Regarding the heartworm, you said there's not a vaccine for it?
That's correct.
Is there preventative measures?
There sure is, yes. There's lots of good options. Probably the past 10, 15 years, most people are giving a little beef flavor chew once a month. It basically has an ivermectin dewormer product in it that helps prevent development once the infected mosquito bites the dog or the cat. here recently, in the past year or so, they have come out with a Heartworm Preventative called ProHeart, which is actually an injectable. And instead of having to remember to give your pet a Heartworm Preventative every month, which is difficult for people, it's difficult for me, and I'm a veterinarian, you just come in twice a year, every 6 months, get this injection, and it helps prevent heartworm disease. Plus, it also will help deworm for some of the common parasites we talked about when they come in for their fecal screening. So it's a great product, and I would recommend that every single animal that lives in the South, and really throughout the United States now, with us having kind of longer summers, warmer winters, they all need to be on year-round heartworm protection. Absolutely, because it is a disease that will kill them, and the treatment is very, very expensive, usually several $100s. On average, it usually varies between $500-800. What you can buy for a lifetime of prevention is about the same as far as cost goes. So it definitely pays to be preventative there.
And that's what I was actually going to ask. The what is the cost compared to the monthly pill that we can't remember to give? The shots. What's
yeah?
The
so
cost
your monthly heartworm prevention usually runs about $11 or $12 a month if you kind of break it down on a monthly basis. And the 6-month injectable preventative is basically, if you take that number times 6, so you're paying more up front, but it's basically the same cost as if you were to buy 6 months of the 1-month prevention. So it's very cost beneficial, I guess you could say.
So it helps with the heartworm, but you said that it also helps prevent some other?
Yes, so your monthly heartworm preventatives also deworm every month that you give it for roundworms, hookworms, and then some types of heartworm preventative will also help deworm for whipworms, which every dog is going to pick up. Even if they're just going outside, they're inside dogs, but just going out, for potty duties, they're still going to be exposed to stuff that's outside on the ground, whatever they chew on. So not only are you helping prevent heartworm disease, but you're also deworming it, giving them dewormer every month that you give it. The 6-month injectable is also does some deworming capacity as well. And the good thing about that product is if your pet comes in for its yearly fecal testing, it shows positive, that company will actually pay to have that pet treated if it shows up positive while on their preventative for roundworms and hookworms.
Okay. All right. What other things do we need to look into? Now, that was dogs and cats.
Yeah, and like I said, these are core vaccines. There are some, there as far as cats goes, I don't want to neglect these guys just yet. There is another vaccine that we definitely recommend. It's called for feline leukemia. It's probably not what I would call a core vaccine, but we see a lot of it around here. We have a lot of outdoor cats. Feral cats is something they're going to be exposed to. So cats basically come in, rabies, feline leukemia, feline distemper vaccine. That's going to cover them for the most part. And like we talked about, Bordetella for dogs and cats, especially if they're in kennel situations, boarding, going to shows, having a lot of exposure to other animals. If you're getting on the equine side, as far as yearly vaccines, obviously rabies is the big one. Eastern, Western encephalitis, tetanus, and West Nile. Those are your basic ones. And then depending on if your horse shows a lot, if they're exposed to lots of other horses when you're out riding at wranglers, whatever, flu rhino certainly becomes important. Your pregnant mares. Vaccines for rhino become more important, leptospirosis, things like that. So there's lots of variation. Your veterinarian should take in consideration, your individual horse's kind of lifestyle, what their work is, what their job is, and then kind of tailor a vaccine program on that. But at a minimal, all horses should have rabies, Eastern, Western, tetanus, and West Nile. Those are basically the core vaccines.
All right, Dr. Luna, I appreciate you coming in this morning. Is there anything else you want to talk to us about vaccinating your animals?
Just be sure it's springtime. This is when we start getting lots of our disease outbreaks, so be sure you're getting your puppies, your kittens, your horses into us. Be sure they're getting vaccinated, deworming, getting all their appropriate testing, and other than that, fleas and ticks are going to be a huge issue. Spread of Lyme disease, we're seeing more and more of Lyme. So be sure you're getting them vaccinated, you're getting them dewormed, you're keeping them on heartworm prevention, and you're doing something for fleas or ticks because we see lots and lots of those diseases here in our area.
And we haven't yet made it to the stage where we can get flea and tick prevention once every 6 months, have we? Not yet,
but we do. Probably the closest product we have right now is called Brevecto. It lasts for 3 months. It is a topical or a chew. It is a great product. We probably sell more than that than anything because it's just, you're giving it 4 times a year, but it's a great product, and that's the one that we recommend at our clinic.
All right. Thank you so much for joining us this morning, Dr. Luna. I appreciate your time.
Thanks for having me, Misty.
That was Dr. Luna from the vet clinic, and he was talking to us about vaccinations. We are going to talk to someone just a few minutes here about some disaster relief, much needed. There's a lot of livestock, a lot of farmers that are just really needing your help right now. We'll be right back.